talking to you.
Yep, perfect. Alrighty, we good to go?
Yep.
Okay, so hi everybody. My name's Tom Swales. My wife and I, we run a physiotherapy sports performance facility here in Barrie, Ontario, and I've been a physio for 12 years now. 12 years. Athletic therapist for 18, strength coach for 20, and I've worked with a couple teams, and now is slowly starting to develop some systems to better educate individuals who want to either treat or train clients better, more effectively, in less time. So today, Jen has asked me to go through some postural correction and assessment that you can use right away with your clients tomorrow. I have put together some of the quick postural assessment that I use with my clients in my SPS system, teaching health professionals as well as with my strength coaches. So the first thing we need to understand is posture. Posture is the position in which we hold our body with regards to gravity. It has many influences. It can be altered by old injuries, pain, excessive posture, sitting at desks, standing excessive periods of time, muscle imbalances that have occurred through our development. Old surgery scars, old wound scars can have an effect on the fascia, which might be creating some tension someplace, then pulling the body towards it. Even cesarean sections, my postpartum mummies who get the cesarean section, huge disconnection, big scar, but nobody tells them that, this incision here that came across your lower abdominal will probably disengage your lower abdominals. You're not going to get the core back unless it's re-educated, and that scar there is now an area of tension that is going to pull all the posture down towards it. Why it gets missed, I don't know, but then when they come and see us, we kind of explain that to them. As I said, pain, anything that's painful, the body will tend to lean towards to slacken it. And even somebody's emotional state will have a big influence on their posture. So if you see somebody who's in pain or who's not confident, they take this kind of slouch protective position. People who are confident and they're relaxed, they take that the chest up, the shoulders down and back position, the confident position. So emotions and your state of feeling that you're in at that moment is going to have a huge impact on your posture. Now, when we're looking at somebody's posture, I'm going to ask a few questions, Jen, and then anybody who answers, just kind of answer them back. When does the observation of posture begin? Does anybody have an answer for that? When should it begin?
So what? The time they walk in the door.
Exactly, right? Before they even know that they're being assessed. So I'll get my clients, I walk out to get my new assessment. Before I even pick up the chart, I see them sitting in the chair. I'm making note of, are they sitting cross-legged? Are they kind of slouched or twisted? Are they sitting on one side of their pelvis? Because already I'm getting an idea of some of the imbalances that they might be coming in with. And lo and behold, somebody's sitting cross-legged, they're like, I have knee pain. I'm like, I think I know why. But it just gives you insight, because as soon as you say, okay, the assessment's beginning, what does everybody do? They stand taller, they stand different. So you have to start your assessment as soon as they enter your visual field. Even when they're sitting there and you're asking them questions, don't tell them you're doing an assessment, because they still won't pick up on that. But as soon as you say, okay, stand up, I'm going to have a look at your posture, they're immediately going to change things. So, sitting, standing. As soon as you say standing, the patient's going to be where? Now, one thing to kind of reset, can you still hear me okay there?
Yeah.
Okay, perfect. This is a nice little reset that I'll get my clients to do. So stand with your feet together, because they're going to stand however they want. So get an idea of the anterior pelvic tilt, forward head posture. They might be still slouching and rounded. Get an idea of kind of the wing, scapula, any atrophy in the shoulder blades, any hypertonic or excessive tone being carried in the chest, the upper traps, or the low back. But to really get an idea is get people to stand with their feet underneath their hips, get them to close their eyes, and you're going to get them to take some deep breaths. Lifting their chest, exhale, and completely wave the spine down. Inhale, exhale, And you get them to do that 3 times and just let them collapse, still with their eyes closed. When they do this, they're going to fall into the most relaxed, comfortable position. So it can help expose or really bring forward what their actual resting posture is without their muscle influence or without their conscious influence. So that'll give you a bit better idea as soon as you start doing the standing postural assessment. Okay? What you want to look for is, number one, I look at their breathing. Where are they breathing into? Are they using neck muscles? Are they using their shoulders? Are they using excessive upper extremity? You're going to look for any excessive spinal curvature going around either side or scoliosis, any excessive kyphotic curves, any winging of the shoulder blades or the scapula. That forward head posture that we all know, that anterior pelvic tilt. So a lot of people will stand kind of like this. So they're opening everything up here. They may have tight hip flexors. They may have weak glutes. We don't know yet. It just might be what they're overusing. But the overall picture that everyone should look at is, if people are being pulled here, what's getting closed down, what's being pulled forward, shortened and lengthened, or shortened and tight, and what's being lengthened and weakened. So if I'm standing like this, already I can assume that, well, I might have some pec minor or some pec major hyperactivity. If my hands are turned in, I might have some overactivity in my lats. I know that my traps and my rhomboids might be lengthened, so the scap retractors. If I'm standing like this, lower abdominals are overstretched, glutes are disengaged, quads and hip flexors might be a little bit hypertonic. So these are just things that we should pay attention to once we start getting an idea of what might need to be fixed. After you look at the posture, though, you should get an appreciation of how they move. And just doing gross general movements through the neck, shoulders. Can they touch their toes? Can they do a back bend and touch the wall? Can they rotate, touch the wall? These are just some general movement checks or movement screens that I'll use with a lot of my workshops, just to get an appreciation of how people are moving freely. And if they have pain, if they're getting pain with some of these things, I might want to do some kind of intervention to release things. Or if I'm applying some soft tissue work in an area, say a hip, and all of a sudden it clears out some pinchiness in the lower back, great, that may have just solved it. So getting an appreciation of their movement, we're going to quickly go through. So everybody, so just standing tall or sitting tall. Everyone just look to one direction, look the other way. And basically see if you can get your chin over top of your collarbone here, over top of the clavicle. And can you bring it down comfortably? If you can, then the rotation, there might not be any excessive tone in the upper traps. If you're feeling a little pinchiness on one side, say to the side closing, there might be some joint restrictions. If you're feeling excessive stretch, might be some levator scap, excuse me, or some upper trap tightness. Can you get your chin comfortably down to your sternum? And don't cheat by, people will do this, they'll open their mouth and try and cheat. Tongue on the roof of the mouth, keep it neutral, and mouth closed. There, can they do it? Yes or no? Looking up towards the ceiling. 10 degrees from parallel, any pain? Can you do it? Yes or no? So just get an appreciation and make sure there's no impingement or pain syndromes or any numbness or tingling going down to the arms. Shoulders. So I'm just going to do this from kneeling, just so you guys can see a little bit closer. So shoulders, can you bring shoulders up towards the ears? Should be able to hit right along the ear line and become vertical. Watch that people don't do this. A lot of people are going to give up those ribs or that lower back to try and find vertical, but when you lock them down, they might actually be here. And this is not a place that you're going to want to get them to press a weight overhead, because they can't stack the spine and they can't stack the shoulders, so they're going to start to shred shoulders. So that's something you want to have a look at. Same thing, shoulder extension. Can they hit at least 50 degrees? So here's about 45. Can they get that? Not a problem. And behind back, can they touch the opposite shoulder blade? Here to here. Okay, so these combined movements are just going to give you an idea of internal rotation, adduction, and extension, flexion, abduction, external rotation. So just combined movements of the shoulder. And do they have pain? Get them to touch the opposite shoulder. Lift it up, clear out the shoulder. See if there's any impingement. Okay, if there's any postural restrictions or breathing restrictions or hyperactivity in the traps, some of these shoulder movements are really going to get jammed up. So you're going to get a better idea if they're overusing or underusing stabilizers back here, or if they're too pec dominant, or if they're too upper trap dominant. They're really going to lock shoulders up. Okay. Toe touch. Everyone should be able to touch your toes. Kids can do it. Adults should be able to do it. I like to do feet together. Okay. Soft knees, but not hyperextended. And just as straight. Can they do it? They don't have to go palms flat, but I want to just make sure that they can get a nice even curve. Same thing when they lean back. I like to do what's called a wall reach test. So I will get my clients to walk 2 feet, 2 of their feet, away from the wall. And I will bring you guys down here a little bit. So 2 feet away from the wall. Okay, at the end of the second foot, both arms up overhead. Reach back and touch the wall. If they can do it, they probably have sufficient hip extension and lower back extension. Same thing with rotation. Can they rotate and touch the opposite hand to the wall? This is just looking at segmental rotation through the body, lower extremity and upper extremity, and can they do it without pain? So you might notice that one direction might be easier to rotate than the other, and that's okay. Most of us are one side dominant. We're going to be naturally rotating. I'm right-handed, so I'm very good at rotating to the left because I swing everything to the left. I have to constantly work on rotation to the right. So I got to do work on that continually in my training so I don't create any imbalances. The last thing, and one of the best ways to have a look at some of these postures, is their balance. If you're doing single leg balance or kind of a Romberg test, a tandem stance, which I'll show you, if they start swaying, especially when you take away their visual fields, it's going to give you really good input on communication from the foot all the way through the lower extremity up to the brain to see how that spine's stacking. So I'll show you first single leg balance. So feet together, keep it even, eyes open, and you're just going to look for sway. You know, are they hiking? Are they doing any kind of weird twisting here? Are they slouching or losing their postural height? Are they compromising? They might be using hip flexors or quads a little bit too much. So just stand there 10 seconds. That's all you need to do. And then switch sides. Okay. Look at them from the front and the back, or sorry, front, back, and side. Whoop. Ankles a little bit off. Okay. And then when they've established balance, close their eyes. See if they get a little bit thrown off it. If you take away their visual field, that changes that they only have to rely on now the communication, the proprioception through their body and the inner ear. Most of us will rely heavily on our visual field and what's in our environment to coordinate our balance. So if you take that away from most people, they might get a little thrown off. So that's just going to give you an indication. When you go single leg, it can really exaggerate core strength and spinal stability. Cool. So, anybody have any questions so far? That's kind of the quick assessment component of what we're going to go over. Is everybody still there?
We're good.
Okay. No questions so far? Is everybody kind of playing with this at the same time or follow along?
Yeah, we're doing it.
Okay, sweet.
Yeah, my rotation's really bad on my neck.
What's that, Jen?
Oh, no, just what I'm finding out with my neck rotation is terrible.
Oh, okay. But is it coming through okay on your end?
Oh, yeah.
Okay. All right, no problem. Okay, so here's where I start. Most of the time, I want to do some kind of breathing check to make sure people are breathing from their diaphragm. If they're not, we got to remember breathing is a movement pattern. It's the first movement pattern that we did. It's the first reflex that we do when we come into this world. If it is dysfunctional, any kind of movement or strength training on top of our training, if our breathing sucks, the movement's going to suck. It's just not going to work. It's not going to be as efficient as it should. And the dysfunctional breathing pattern will facilitate any other faulty movement patterns that we may adopt through our training or through development. So everybody, I can't see you, but I want everyone to just stand or sit, but I want you to put one hand on your chest, one hand on your belly. Okay, and everyone should be able to breathe through your nose and breathe into that lower hand. There should be next to no movement in that upper chest here, in this upper hand. So everyone do a few breaths. And the rate and the rhythm should be about 4 seconds in, 8 seconds out, with a 1 second pause at the top and the bottom. So it looks like this. So it's 4 seconds in, pause, 8 seconds out with a pause. That's the resting rhythm that most of us should do. So which it'll bring us to anywhere from 6 to maybe 10 breaths a minute. 10 is still a little bit high, but resting breathing should be around that pace. Most of us are anywhere from 12 to 20, which will put us into hypocapnic. We're blowing off too much CO2, which causes us to hyperventilate. Our blood gases start to change. But what that does is it throws our nervous system into the sympathetic state, where it's that fight or flight zone. And when we know we're in fight or flight in that sympathetic zone, cortisol's high, blood sugars are going to get thrown off, and there's no recovery, there's no learning in that sympathetic state. We have to stay parasympathetic. Now, it's not to say that sympathetic state is good for a short period of time when we're training, when there's an emergency. We need to utilize that system to dial up the nervous system and utilize fuel quickly. But most of us are living in that state because we're not managing stress, we're not managing diet, nutrition, whatever it is. And that system is just running us in the background, and we're grinding ourselves into the ground. And we can't recover, we're getting more sick, and all kinds of other issues. But we can control the system simply through changing our breathing pattern. So the first breathing that I want people to do, and I'm going to come on down to the floor, I'm kneeling right now, so I'm just going to turn that there. Legs up on a bench is ideal, just because it doesn't move around. Most people will get this 90-90 breathing. So again, one hand, or a shoe or something, one hand on your stomach, one hand on your chest, and you're just going to breathe in through your nose. Let the belly rise, and I want you to exhale through pursed lips as though you're trying to blow through a very tight straw. What that'll do is it'll cinch up. At the end of your exhale, it cinches up your transverse abdominis, that inner core muscle, and pulls the corset together to stabilize the back. The best way to recruit that transverse abdominis is at the end of a breath, and it's regulated by the diaphragm. This whole, try and consciously contract the TA, can't do it, right? It's a reflex-driven muscle, and the best way to do that is through proper breathing. So try that on your back. Everyone, put your legs up on the bench just to take the pressure off the pelvic floor, take away any of the postural demands. Because as soon as we get up and standing and sitting, a lot of the postural muscles, they start to come on, and it might change our breathing back up into the apical, the upper part here. So laying down is ideal. If your clients or you can't figure it out, or you can't feel it out, the next best one is actually crocodile breath. And this is where you're going to lay face down on your stomach, forehead on your hands. Okay? And you're going to use the floor for feedback. So your client's going to feel the belly press into the floor. And by holding the arms up here and allowing things to breathe, you can feel the shoulders start to relax a little bit better. So pick whatever position works best for you. Just note that just because you catch it or regain it down here, as soon as you get up into sitting or standing, it might default back to that upper. So it's going to take a little bit of work and conditioning to change your breathing pattern to keep it down into here to start stabilizing, because our center of gravity sits around here, but this is also where we transmit torque from the upper and lower extremity. So this is supporting everything above, and if this is getting faulty, if I'm side bending or I'm getting hypertonic, all the posture gets thrown off. So we need to dial back in proper breathing patterns. Cool. Jen, anybody have any questions so far?
Just why do you call it crocodile?
Oh, I got it from yoga. Yoga likes to use animal names for a lot of their poses. So crocodiles are on their bellies, and crocodiles are all low to the ground, so they kind of drag their belly on the ground, and so when they breathe, you'll watch them and their bellies just go out to the sides and into the ground. But I don't know, yogi thing.
Alright, yeah, I haven't heard of that one.
Cool. Okay. Is that the only question?
Yep.
Yes?
Yeah.
Cool. All right. So next thing that we're going to do is the muscles that typically are at fault or overused or hypertonic to cause muscle problems. We'll quickly go through the list. Everything that I talk about, by the way, I'm putting it into a Word document. Everyone will have access to it to download for free on my website as well as with this video. So if you need to review anything, you can go there and get it after the webinar once I clean stuff up. All right. So most common muscles: upper traps, pectoralis minor, latissimus dorsi, teres major. They tend to get hyper, especially if the lower traps aren't doing their job to depress the shoulders. We'll try and use the lats to depress and set the shoulders, but they end up kind of cranking the shoulder down, and then that facilitates the upper trap. Now you got these two muscles fighting one another. The upper abdominal, so again, coming back into people with that rib flare, the upper abdominals are carrying too much tension around the diaphragm, so those need to be released typically. Lower back muscles, kind of around TL junction, kind of the upper low back, they tend to get hypertonic because the trigger points, there might be trigger points in the abdominal area that are pulling this way. So the low back muscles have no choice but to prevent the broken nose by wiring up. So people who feel low back tightness, I rarely have to manipulate or do soft tissue work in the low back. I go poking around in the front and also in the low back relaxes. I go poking around in the hips and the low back relaxes. I get the glutes to activate and the low back relaxes. So we'll typically feel that tension in the low back because the low back muscles are trying to recruit, or they're trying to get recruited to do someone else's job. So don't always go to where we feel tight. It might be the weak zone. So always just look at how people move. Make sure that both hips can extend, they can flex, they can rotate. If a hip can't rotate, we're going to go into knee or low back. So don't chase pain, don't chase tightness. And don't assume just because it feels tight it is. It might be just weakened or overused. All right. Hip flexors are usually culprits. Again, the more I've been in this field, the less tight hip flexors I see. I see overused hip flexors. I see weak hip flexors in the short range. But as soon as you activate them, they relax and they let go. So it's more they're just being used for the wrong thing, maybe to stabilize the back. Hamstrings, quadriceps, calves, and the plantar fascia. Those are kind of the majority of areas where you're going to find trigger points that might be altering how you move. Right? Some of the tools I use: foam roller, lacrosse ball, acupressure ball, or the rolling stick. So if anybody has access to the stick. Now, the foam roller, I'm sure everyone's had experience with this, and lacrosse balls, and everyone's kind of used it. I'm going to go through just a couple major techniques that I use, or areas that I use for specific reasons. With the foam roller, pinning and breathing, and then pinning and moving type of techniques that I'll use. So let's go into, so we've got our client who has the kyphotic, rounded shoulders. They can't really extend through the rib cage very well. And we're going to assume, after we've watched them move and somewhat assessed, that their thoracic spine just doesn't extend or rotate very well. This is where you're going to take your foam roller. I'm going to move this ball. And instead of just massaging the muscles, because they're usually not at fault, we're going to use it to self-mobilize the joints themselves. So you're going to hand behind your neck, protect the neck, keep your butt on the floor, and set a breath. So you pull that belly button in, protect your lower back. Find the stiff point and just let your shoulders fall over top of the foam roller. Cycle a breath and come back up. So by letting my shoulders fall over top, I'm actually mobilizing and creating a glide in through the rib cage, in through the thoracic spine, at a few segments at a time. And I can move up and down the thoracic spine from the top of the shoulders to the lower ribs. Don't do this into your lower back because you're going to create shearing and you're just going to jam up joints. The low back joints are designed to prevent extension. They don't extend very well. So don't encourage extension down in there. The thoracic spine, however, is designed to extend and rotate. So you might feel and hear a couple little pops. That's okay. That's just the joints slowly, but don't force pain. The whole sympathetic nervous system ganglion, they sit in that thoracic spine. If you overstimulate or cause pain, it's going to light it up and you're going to go sympathetic. All right? Once that's cleared out of the way, once we've got a little bit better extension from our clients, again, we can come back down, take our foam roller, lock up our lower back, grab some ribs, and just pull those ribs towards the sky. So this is going to help create some rotation through the rib cage. It's important that you bring this leg up to 90 degrees, lock that lower back, and then make sure the movement, rotation is happening through the rib cage. If my leg is lower down or I'm letting that lift off, that rotation is going to go to my lower back. The lumbar spine is not a rotation joint, so don't encourage rotation there. So important, if this is all you got, that's it, work with it, okay? And just work with your breathing patterns. Inhale and exhale. After about 5 to 10 reps, you're going to feel and notice that shoulder is going to drop down towards the floor a little bit more. Then you can start to make it more active with a couple little activation exercises. With the foam roller, with the lacrosse ball or acupressure ball, so I talked about pec minor being a culprit, upper abdominal being a culprit, hip flexors being a culprit. Typically I'll get on the wall. I'll just show you here, pretend that my hand is the wall. So I'll have my clients pin the ball into that pec minor, which is kind of just below the clavicle, but really just find the ropey points or the trigger points. Pin it up against the wall, and then move the shoulder on top of it. And then place the hand behind the back. So pin it, and then move the limb. Okay? This works in a better fashion to really open up and lengthen the tissues. To sit there and do this, it's a massage, but you want to teach the motor system to move on top of the new length it's creating. If I just massage this, it doesn't mean this learns something new. So it's going to save you time, it's going to be more effective if I just hold the tissue there and I move my limb around it. And I'm getting new input, I'm getting new proprioception at the same time. All right? The upper abdominals, even the abdominals in general, if everybody just pokes around the abdominal cavity in the obliques, hip flexors, you might find, surprisingly, you're like, oh, that's kind of sore. Now, you didn't notice this until you started poking around, but your brain noticed it. And if your brain knows there's trigger points there, this is essentially what it's doing. Pretend this is fascia. It's doing this to my body. What's that forcing me into? A flex grounded position. Because my body doesn't want to stretch against those trigger points. It doesn't like it. It feels uncomfortable. So that's where we can't stretch through trigger points. Don't bother, because it's going to flare them up. It's going to activate them further. And actually, it's going to continue to be pulled towards the opposite direction. So we have to work those soft tissue trigger points out before we start stretching. So, abdominal. It's not going to be comfortable for most people, especially when they're new to it. Find the trigger point. You could just sit and hold and breathe into it. That might be all that you need. But for some of you, use your body weight and just do crocodile breath on it. And you're just going to breathe on it till it eases off. Then go and find another point that might be a little bit flared out. And work in underneath the ribs, working around the diaphragm, work the lower abdominals, work the hip flexors. Bring it all the way down. Find that iliac crest here. Stick it on the inside of that hip bone. Find it there. You can do some cobra poses on it and breathe. You can do some glute activation. So you're going to pin and move while activating the glutes to create more hip extension. Okay? But do what feels the most appropriate. Don't go into a crazy amount of pain. Don't go into beating the crap out of it. it's just going to facilitate it further. It's got to be kind of that comfortable discomfort, if everybody understands what that means. All right. So you can use this for the majority. Piriformis, people will have trigger points in their piriformis, but again, it's not truly a short muscle. It might be an overactive muscle. But if it makes you feel better, if it gives you better glute activation, that's where you're going to do that leg crossover movement, roll towards that side, and work on it. If you really want to punish yourself, sit on the acupressure ball or a lacrosse ball. That'll really light you up. But I find the foam roller tends to get deep enough on most people, but it's up to you. All right? The calves. Again, one of those muscles that we will tend to overuse, typically because some of the ankle stabilizers or foot stabilizers aren't doing their job. So we'll tend to have trigger points in the calves, which then limits our ability to touch our toes. It can limit our ability to straighten a leg. So, pin and move. Get your lacrosse ball. Lacrosse ball will get a little bit deeper in between the calf bellies. So find the nasty point, and instead of just rubbing it around, move the ankle. Activate that tibialis anterior on the front in those inverters, everters. As they gain new proprioception and new length, they're also getting a little bit stronger against the resistance. Okay, so find, pin, and move. Okay. Work to the outer calf, lateral calf. You can get into the peroneals. Yep.
Like, by doing the pin and move, are you creating more friction in that area to break up the trigger point?
Yes, you're creating more blood circulation, or
and friction. It's not just rolling over it, but you create it.
Yeah, so you're pinning the tissues together, and by moving it, you're stripping them apart. Okay, so if there are any adhesions in there, you're going to break those up. If the collagen or the fascia is a little sticky, you're going to help unstick it a little bit. So it's like it's almost like a self-active release. All right. So, but it's more important that, and it's more effective when you can actively move on top of a stretch. You're getting two for one, because you're getting active range and you're getting strengthening and you're getting inhibition of the muscles that actually might be hypertonic or overused or tight. All right, cool?
Yep.
Cool. All right, the feet. If everyone pokes around their feet, just get your lacrosse ball, you might find trigger points around there. Most of us, being trapped in shoes all day, feet are weak. They don't know how to engage and grip with the earth anymore. The intrinsics are dead. And we tend to overuse calf muscles a little bit more. So just doing some rolling in the feet. Now, you can make it, so pretend this is the front of my foot. Do a triangle. So go from the inside of the foot, inside arch, to the heel, to the outer arch, to the medial, or the frontal arch here, transverse arch. So you're kind of making a triangle around the foot. Hit it 8, 10, 12 times. And I've had people where just getting them to release their feet, all of a sudden they can touch their toes because their whole system relaxed. The fascia, we have to remember that the fascia on the bottom of our foot travels up the back of our leg, up our spine, and finishes into the frontalis muscles here. If anybody has ever looked at the textbook anatomy trains, you'll understand what I'm talking about. Fascia is continuous through the body, and it wraps around, and it doesn't just stop at one bone to the next. It's what helps communicate the system and conduct electricity around the body, as well as create tension and suspend us. So those are going to be your main areas. Quadriceps, again, if you see people foam rolling, we'll go into this. Pin and move is ideal. So this feels good. It's going to help increase blood circulation. It's going to decrease sensitivity in trigger points, but if you want to create more range of motion, find the nasty point and then just bend. Activate that hamstring on top of it. We can always use reciprocal inhibition to get more out of a flexibility or a trigger point release. Okay? So find those speed bumps and move over top of them. All right? Cool. All right. Pin and breathe, pin and move. All right. So that's a lot of the soft tissue work. Anybody Everybody's got that part?
Oh, yes.
Everyone's good?
I was trying to see if I could get a speaker to the ladder, but never mind.
Are we good?
We're good.
All right, sweet. Okay, so once we've done some releasing, once we've done some soft tissue work, now we want to start activating certain muscle groups, because if you get a client and they've got all these trigger points and you're just like, oh, well, just fix your posture. Well, if they've got trigger points here, they're going to lose. They're going to lose that battle, and those muscles are going to fatigue out. So again, really important to work on the soft tissue work. Typical muscles, they get weak. If we are forward head posture, what are we lengthening and weakening? Deep neck flexors, right? What are we getting tight? Chest. Well, it's getting long and weak. Scap retractors, lower traps, they're getting lengthened and weakened. Typically glutes get lengthened and weakened because we sit on our ass all day. The hip flexors actually get short and weak. I'll talk about that. We might have some time to go over some hip flexor work. Tibialis posterior, so the muscles inside the ankle that help pick up the arches. If people have collapsed arches, their knees are going to travel in with it. That's going to disengage the glutes. So weakened medial ankle, medial foot stabilizers tend to get weak because we're in shoes and we're not barefoot. Outer glutes, people sitting cross-legged, those completely destabilize. The deep hip rotators, they shut down. So everything that's supposed to be stabilizing our backs and our hips and our pelvis and our necks, they just get lengthened and weakened. So, neck, we'll start here. So pin those shoulders back a little bit, but just, you can get, if somebody's not quite getting that double chin, that neck retraction, the slide, to shorten this up, get a tennis ball or a lacrosse ball, get them to hold that there. Just to give them a sense of, all right, I know what that feels like. I know, just by holding that ball there, the deeper neck muscles are going to kick on a little bit. And you don't have to crush it. It's just hold it there just enough, and people should feel a little stretch at the base of the skull if they're doing this correctly. So the cue I'll use is pretend there's a string at the back of your head and you're sliding the head back. I'm not tipping the nose down, the nose stays parallel, and I'm just kind of holding that there. And then while I'm there, I'll get them to just do some rotations or some head turns. Again, people with a forward head posture, they'll do this and slide and shear that neck away. So they'll hear grinding and crepitus through the neck, but as soon as you tuck them in and get them tall and get them to rotate, that cracking typically goes away because you stack the spine and everything's lined up better. All right, so always start with the neck, and you can facilitate with the eyes. If someone's got a really cranked up neck, just get them to look to the side, because the eyes, the muscles deep in the eyes actually facilitate the deeper neck muscles of the upper neck, and it initiates rotation, because the eye reflex is actually the third reflex that babies start to use. I say the third because the TMJ is the second one. All right. Lower mid traps. Okay. Simple scap depression. All right. Okay, so we'll get into, if everyone's sitting, because I can obviously see you, everyone just sit cross-legged. So let's start this from the floor. Sitting in chairs is typically destructive to us because the hips get tight, the glutes get disengaged, and we can get sloppy and rely on the chairs. But sitting on the floor can actually be very restorative. It's hard to get sloppy with your posture on the floor because what happens? We fall over and we lose our balance. So I have to maintain some kind of tone in my spinal stabilizers to make sure that I don't fall over. As I'm sitting cross-legged, I'm opening up my hips. But after a period of time, it's going to get uncomfortable, so what can I do? I can change my hip position. So now I've got internal rotation here, external rotation here, and I can maintain and keep a different posture. When I get tired of that, I can sit this way. Again, I might feel, oh, that feels a little tighter in that hip, but I'm also getting an appreciation of, oh, that hip feels different than that hip when I sit like this, so maybe I need to spend a little bit more time here. Working on clients transitioning here is going to work on balance and core. Okay? It's going to work on weight shifting and better body alignment. It also is going to give them the transitions in which to come up and open those hips here. So this is one of our ground transitions that we'll work on to open up hips again. And then from there, you can get them to transition into lunge and then standing. All right? Seated. So that seated 90-90 position that we were just playing in, just getting people to turn and rotate. This seated 90-90 stretch is just magic. Most of us are locked into flexion with the thoracic spine, and we don't rotate very well, and the hips don't extend and rotate. So just sitting with the foot on top of the thigh here, and you're trying to rotate where you're squaring off your body to the thigh. Here, I'll turn around this way so everyone can see. So now I've got hip extension, internal rotation. I've got hip flexion, external rotation. I can lock up my shoulders and look over my shoulder. And here I can just work on breathing. When you get somebody to breathe deeply, they might feel tightness across here. They might feel in the hip. They might feel in this one. I don't care. They're feeling it wherever they're tight, and they're just going to breathe into it. So this is really one of our go-to mobility stretches, just to get people to create more rotation and extension through their thoracic spine and their hips. So that one is one that I really use a lot. Next, kneeling. Okay. Oh, you can also do, while you're sitting in any of these positions, if someone's got a tight neck, just get them to do some neck rotations in this position. Teach them to depress those shoulders down and back, dissociate the neck. Okay. You can even get them to do some openers here. So if I'm sitting pressed, I can open up my rib cage a little bit more in that shoulder, but watch this shoulder doesn't punch forward. That's what a lot of people are going to want to do. Keep it rolled back and press that floor away to open up the thoracic spine. Okay. So we'll come up into kneeling. Same thing. Kneeling, when you're looking at somebody kneeling, it takes away foot, knee, and ankle. Now you get an appreciation of what is their posture, or what is their pelvis actually doing. It's very hard to exaggerate and stand like this in a kneeling position. What do they have to do? They gotta lock their glutes under. They gotta stack their pelvis. If they can't, they look silly and they just fall over. So getting people into this tall kneeling position, feet turned in, so you can see, okay? Don't let them turn the feet out. That's going to crank into the knees. And once they feel comfortable here, put a kettlebell in their hand. Right? Grab onto a kettlebell. Push the kettlebell towards the floor and just do some neck rotations. Before you get somebody to deadlift, make sure they can hold the kettlebell. Because if you get them to deadlift and they're cranking up in that neck, it's not doing any good. They're dissociating and they're just going to make the neck worse. So if they know how to hold the kettlebell and be relaxed and create tension in their glutes and their scap retractors, then they're going to be good for the deadlift. And then even just bringing it to the side, they're going to feel the glutes kick on a little bit more. So doing some kettlebell holds in the front and then in the back here just helps open up the neck, shoulders, and pelvis. And just focus on breathing. Okay? Lost my list. Does anybody have any questions so far?
No, we're good.
Cool.
With that kneeling, I guess that's a good one.
Yeah.
Just a time check. So I've got a couple here that have to leave.
Sure.
Like to 9.
Yep. We'll be good.
Okay.
Yeah, we're almost done.
Okay.
All right. So everyone's used. I'm just going to go quickly to the hip flexor stretch. Everyone's used the hip flexor stretch. I just want to make sure everyone's using it properly. So when you're doing this, so tall kneeling to half kneeling. This is a nice transition if you're trying to look at somebody how they're walking. So just put their hands on their pelvis and see if they're doing any kind of weird, wonky positions here. But get them into that hip flexor stretch. Lock this, so tail tuck. Hands on the thigh, core activation, press on the thigh, then make them go into it. If you don't set here and here and lock that in, you go anterior pelvic and it's all lower back. So I just wanted to make sure that if anybody's stretching hip flexors, or that they need to, make sure those glutes are staying on when they're doing it. Okay, come up into standing. I feel that when people are doing warm-ups, I think they get overcomplicated with things. Just doing something as simple as joint circles, highly valuable. If we're not doing this for the majority of our day, then we lose that input and the joints stop moving those directions. And that can have a tremendous impact on our cerebellum and how we're kind of integrating the body. So don't underestimate joint circles in many, many directions, elbows, shoulders. Okay? And before you do this, have your clients touch their toes and then just have them do some simple joint circles, right, through the spine. And breathe. Do the ankles. So just do some simple ankle circles. Stretch, right? Do some knee circles. And then have them touch their toes. 9 times out of 10, they're almost going to hit their toes every single time. Just because they woke up certain receptors in their nervous system and in their brain, and it actually relaxed the body and gave them more a better input-output. Okay. Specific strengthening for the neck. I know we did the tennis ball, but again, highly underutilized isometric exercises. They create and build a lot of strength. So something as simple as once people know where the position is, apply some pressure. Just enough pressure that they can feel the muscles without overpowering. You can apply this, or they can apply it themselves. So keep neutral neck. Just apply some pressure to the side. To the side. You can do rotation. So look to the right, look to the left. And even you can do it in ranges. So if somebody feels tight, they're like, oh, I can't get my chin to my chest. Let them go as far as they can, and then let them go. I get clients, they just, because they're on their phone all day, they're on the computer, they've lengthened, and those muscles they don't know how to turn off. And these ones they also turned off in the short position, but as soon as you turn these ones on, these ones relax. Looking up, people get pinchy necks. Hands behind your head. Push your hands or your head into your hands, and then see if you can go a little further. Again, because most of us are looking down all day, the muscles, we've lost strength in the short range in the extension here. So we get pinchy necks, but if you just apply some tension in the range that we might be a little restricted in, all of a sudden you're like, oh wow, that feels better. So don't underestimate isometrics. Just waking up on muscle for 5 seconds or a few breaths, and then check the range of motion, you can get things to move much more freely. Scapula, a favorite of mine. So sitting, I'll set this up. Again, I'm all about saving time, so if I can open my hips and stabilize my shoulder blades at the same time, I'm going to do it. So ring sit, people with tight hips, stick a couple foam rollers underneath your hips, underneath your knees. So I'm going to sit here. My pelvis, my lower back is flat, my ribs are down, and I'm going to wall slide. And I'm going to move with my breathing. As I go up, I hit my barrier, exhale. Okay. As you move further and further, you're going to get higher and higher up over that. If this is your range, play with it. That's it. I don't care. But I want the back to stay flat against the wall to get those scapula to move under good control. The next one, so if I do the back, I want to do the front. If you see people's scapula winging up, especially with a push-up, most of the time it's the serratus anterior that's a little bit shut down. So I don't know if you'll be able to see this properly. You might be able to see it here better. Yep. Make a V. I'll show here first. So I'm going to make a V with my hands. I'm going to lock my pelvis under. I'm going to push my shoulder blades forward, and I'm going to roll those up. If you're doing this correctly, you might or should feel a little bit of spasm in that serratus anterior in the front of the scapula here. So you're going to hold shoulders forward and roll it up. Do a little neck rotation at the top to make sure that you're not shrugging and using the upper traps, and then come back down and relax. Okay? So that's a huge stabilizer that works with the lower traps to help control upward rotation of the shoulder blade or the scapula, so that upper trap stays out of the equation. Scap rotation, I'm doing for time here. All right. Okay, tall kneeling, scap, neck rotations. Again, give the person or the client some feedback and get them to move their head. If they're doing this, cranks up their neck. You got to be able to keep your neck dissociated and relaxed. We don't need it there, okay? You can do this laying down. If somebody's really getting cranked up, you can do it laying. So I can go here and just T-bar it, cross. I can add in some thoracic rotation here, okay? So then it's in addition to rotation with the rib cage. All right, last but not least, we'll get into the core. So again, everything up here is sitting on top of this, and all this is sitting on the pelvis. So I consider the core anything from here to here. Dead bugs, bird dogs, side planks, front planks, bridges, okay, and clams. All probably sound very familiar, but just a couple of nuances. Just going to bring this down. Dead bugs, see them done a lot, see them done poorly. Always start with a breath. So set the core, arms and legs up, and you're going to drop them down, but you got to keep that lower back flat and pinned on the floor. If I'm letting my back arch like this, core's not on anymore. So it's really important that everything stays down and you can control and you breathe. If you cannot breathe here, you don't own this. Come back until you own it. If you're holding your breath through anything, you're telling your brain and your nervous system, I'm dying, I'm going to start to panic, and that's just survival. So don't take yourself to survival mode. There's no learning in there. You have to be able to breathe and control it. Bird dog. I like to be mean with my clients. I'll get a ball or a block or a foam roller. I don't even know if I'll be able to do it with my back. Yep. Nope. If you got a yoga block, be less mean. Okay, something for feedback that they can feel if they're losing position here. So I'm going to draw up, neck neutral, don't let them poke. So keep that neck nice and neutral, and you're going opposite. So putting something on their lower back is going to give them feedback in case they start twisting and rolling around. And typically I only hold for 1 to 2 breaths. Side plank. I'll start people here because I need everyone to feel certain muscles. You have to feel outer glute, gotta feel that glute medius, gotta feel oblique, and gotta feel lat. If you can't feel lat, you're gonna use your upper trap. If I rotate slightly forward, that's gonna go into TFL hip flexor, but if I slightly roll back, now I can feel my outer glute. Hold the arm up and just do some neck rotations. Again, I'm just teaching my neck to stay out of it. Okay? Front supports or planks. Tuck that tail under, okay? I'm not rounding my spine, but I'm just doing a little tail tuck. And I'm doing scap protraction here. Same thing with your plank. If I'm like this, my back is hyperextended, I'm just sitting on joints. But as soon as I squeeze my bum, it pulls my abdominals together, and it actually engages the core effectively. And then bridges, okay? Last one. And I'll get my clients to feel this too. I'll get them to lift up. I'm like, where do you feel it? They typically say my hamstrings and my low back. Okay, fine. Set the breath. Lock that down. Dig your heels. Squeeze your bum and go up. They're like, oh, now I feel my glutes. So there's a big difference between this and this. This is glute dominant. This is back dominant. It doesn't look that much different. But if you ask the client, what do you feel? That's going to give you your best feedback. So always ask your client, what do you feel and what muscles do you feel working? Let them make a mistake. So then they feel the wrong one, then correct them. Because you never know, they might surprise you and they might do the right one. So let them try stuff, so long as it's not unsafe. and then let them feel the mistake, and then they can learn from the mistake, because that's really where motor learning comes in. Watching my kids grow up, I don't tell them how to walk. I don't tell them how to crawl. I put them in environments and let them figure it out. They make mistakes, and they learn from it. But if we can put ourselves in environments or give ourselves feedback that we can best make our own mistakes and make our own corrections, we're going to learn the best from that, rather than a coach trying to verbally explain, okay, well, tuck your tail and pull your ribs down and breathe and pull your shoulders back. They get frustrated and we get laryngitis. So it's not a good scenario on both ends, but if you know how to cue them properly and give them the right feedback, both parties are happy. Okay? So I hope this was helpful. Any questions there, Jen? Time is it? You guys still there?
Oh yeah, we're just talking questions.
Oh, okay, cool.
Yeah. No, that's awesome info, great tools and ideas. Yeah, thank you so much.
Of course. So I'll put this up on my website, so tomswirls.com. Jenny, I'll send you the link to that. And as a gift to everybody, if they want to delve more into kind of fixing shoulders, not so much rehabbing shoulders, but using a lot of strength exercises and principles for their clients, I'll set up a code for everybody for 25% off on my shoulder health and muscle up course that I have online, so everyone can have access to that at a discounted price. And I'll have the notes also for everybody to download as well. So when that's all up on the website, Jenny, I'll let you know so you can send it out to everybody.
Okay, awesome. Quick question then. If you're pressed for time with the client, like you just needed to do, what would be like the, let's say, 3 main warm-up exercises that you would recommend?
The 3 main exercises, you know what? If I'm pressed for time, I just think, okay, how can I activate everything around this? I'll go some kind of front core, climbers, dead bug, depending on their skill level and their control level. So I'll think front core, dead bug, climbers, anything along those lines, some kind of support, a side plank, and glute bridges or bird dogs, right? So now I activated front core, side core, and back core. Most of the time when those three areas are happy, everything else starts to free up, because we develop strength in our midline, and if we get this all dialed up, then everything else on the extremity, it starts to move better. We get better output, we get better power. But if we're not stabilizing here very well, then we start to draw in tightness from other muscles to try and stabilize our spine. Our muscles are slaves to our nervous system, because the nerves govern and they tell what the muscles to do. But if the nerves aren't happy or the nervous system is not happy, it will sacrifice muscles and joints to protect itself. So protect your midline, strengthen your midline, and the extremities will typically take care of itself.
Awesome. Thanks so much.
All right.